the weapon. We're trained to look for violence where it's visible. A man with a gun, a bomb, a screaming headline, a body on the ground. But in a modern, interconnected world, the most lethal weapon often isn't a bullet. It's a signature, a pen moving across paper, a budget line cut, a system dismantled, a warning ignored, a dataset deleted. Because when a leader chooses to break the structures that keep people alive, they are not merely reducing costs. They are assigning mortality. And the people who pay are usually the people with the least power to resist. So this is not a partisan argument. It's not a culture war performance. It's not even a debate about ideology. This is a ledger, a human ledger. And once you look at the ledger, once you look at the ground truth, the scale forces one question. What do we call it when governance becomes a machine that predictably produces mass death? Exhibit A, the American toll. We hold the memory of the world wars as America's ultimate sacrifice. We teach it in schools. We carve it into stone. We pass it down like scripture. And that's why the comparison matters. Because it reveals something we don't want to admit. Sometimes the deadliest force Americans face is not a foreign enemy. It's our own administrative failure. The fact roughly 229,000 Americans died fighting Hitler and Mussolini in World War II. Those deaths came from a war machine, a dictatorship, an enemy openly committed to domination. The contrast, in the space of a single year, by January 2021, roughly 400,000 Americans were dead from COVID. And the argument in this case file is not that a virus is a moral agent. A virus has no ideology. A virus doesn't choose, but leaders do. The case claims that the early response, dismantling preparedness, dismissing science, downplaying danger, turning basic public health into tribal identity, did not merely mismanage a crisis. It multiplied it, and the toll didn't stop when the calendar turned. By early 2026, the United States has suffered roughly 1.2 million COVID deaths in total. That includes 800,000 additional deaths after the first term, after vaccines existed, after we knew more, after there were clear paths to reduce harm. This is where the file introduces the next charge. Not just failure, the messaging effect. The data summarized here points to a deadly pattern. Politicized misinformation didn't just confuse people, it killed them. One widely cited estimate in the dossier places 232,000 deaths in a specific period as potentially preventable among unvaccinated adults, lives that could have been saved with basic vaccine uptake. And research highlighted in this case describes a widening mortality gap aligned with partisanship, behavioral differences in masking, vaccination, and exposure that translated bluntly into funerals. This isn't abstract. It's not opinions. It's oxygen levels dropping in an ER. It's an empty chair at a kitchen table. It's a nurse holding up a phone so a family can say goodbye through a screen. And the case asks you to sit with one brutal truth. A lie about a virus can be deadlier than the enemy we once crossed oceans to fight. Exhibit B, the global toll. If Exhibit A is a national tragedy, Exhibit B is the point where the story moves into world historic catastrophe. Because when you dismantle the infrastructure of global health, you don't tighten budgets. You cut the cord. You sever the umbilical line that carries medicine, nutrition, prevention, and survival into the most vulnerable parts of the world. This dossier centers that cord on one symbol, U.S. aid, and it frames the consequences in plain mechanical terms. When you stop delivering antiretroviral medication to millions of people living with HIV, people don't adjust, they die. When you end nutrition support for children already on the edge, they don't bootstrap, they waste away. When you pull the plug on basic treatments, malaria care, pneumonia meds, diarrhea interventions, death doesn't arrive as a dramatic explosion. It arrives as a quiet certainty, a clinic with no stock, a mother turned away, a child's fever that never breaks. And here is the central claim of the file. The projected death toll from these cuts is not a theory, it's arithmetic. The dossier presents estimates that, if policy trajectories continue, place global mortality in the range of millions per year, accelerating as stockpiles vanish and healthcare infrastructure collapses. It describes this as a waxing phenomenon, a rising curve, because so much of global health has a lag. You can interrupt treatment today, and the death may arrive months later. You can weaken nutrition now, and the body fails down the road. You can break a clinic network this year, and the epidemic you seeded blooms later. That lag is not mercy. It's the fuse. The projections summarized in the case file reach into the range of 6.6 to 9.2 million deaths by 2029 from the global aid dismantling alone, numbers that, combined with domestic projections, are framed as 7 to 9.5 million total lives lost by January 2029. And the narrative isn't satisfied with saying that's big. It forces you to compare scale. Alexander the Great's decade of conquest, an empire built by sword, cost roughly 1 million lives by many historical estimates. This dossier argues that in our era, a pen stroke can set in motion a death toll several times larger, without a battlefield, without a siege, without a single soldier raising a weapon. And the file uses a phrase that is meant to disturb you. A shadow holocaust, not an equivalence of intent or machinery, but a numeric confrontation with scale. Mass death not through camps, but through a calculated withdrawal of life support. Because the victims are not executed, they are abandoned, and abandonment at scale is a form of violence. Exhibit C, the pattern. This case is not built on a single moment. It's built on repetition, a serial pattern, not in the cinematic way we imagine killers, no dark alley, no bloody knife, but in the administrative way, a recurring willingness to treat survival as an expense to be trimmed. The file lays out the pattern like a timeline of broken systems. They broke the pandemic response capability and hundreds of thousands died. They broke global aid, and the death curve begins to climb year over year. And now the dossier argues they are breaking the domestic safety net. Health coverage, Medicaid support, nursing home protections, environmental safeguards. Here the case file becomes brutally specific. It frames domestic mortality as administratively assigned deaths, avoidable deaths driven by loss of insurance, weakened standards, and increased pollution burden. And it emphasizes the same concept again. Waxing, not a one-time spike, a rising annual toll. The file's projections climb through 2026, 2027, 2028, each year increasing as cuts compound and the sickest populations lose what kept them stable. Insurance loss is not theoretical. For someone managing chronic illness, coverage is medication. Coverage is insulin. Coverage is a dialysis schedule. Coverage is the appointment you can't skip. And environmental rollbacks are not symbolic. They are particles in lungs. They are soot in bloodstreams. They are heart attacks that arrive earlier than they should. The argument here is simple and devastating. When you repeatedly dismantle the systems that prevent death, you don't just govern. You shape the mortality curve. Exhibit D, the information crime. And then the final piece. Because mass death can be tolerated politically if it is made invisible. In a functioning democracy, people govern themselves using truth. But this case claims that truth has been treated as an enemy. Health data deleted, agencies silenced, tracking systems shuttered, numbers obscured. Why? Because if the public could see the ledger clearly, if people could watch preventable deaths accumulate in real time, many would stop calling it policy. They would call it what it resembles when stripped of euphemism. A machine that trades human life for power, narrative, and budget ideology. And if you can't see the machine working, you can't stop it. So the cover-up isn't a side note. It's part of the weapon. Because a signature can kill once, but deleted data can kill indefinitely. Conclusion, the ledger. This is the heart of the dossier. We are used to thinking of death as something loud, but modern death, the kind produced by administrative withdrawal, is often quiet. A clinic closing, a treatment interrupted, a standard removed, a lie repeated until it becomes someone's last decision. And the case doesn't ask you to memorize every number. It asks you to accept a principle. Governance is life support, and life support can be turned off. When it is, the victims don't vote on it. They don't consent. They don't bargain. They simply disappear one by one into a hidden ledger. And that is why this is not just politics. It is a human accounting, a moral accounting, a record of what happens when a nation and its leaders treat survival as optional. The only difference between the killer we fear and the killer we fail to name is that today the weapon is a pen, and the bodies are kept out of sight, behind a wall of paperwork, euphemism, and missing data.